Well, I think there's some basic principles that need to be understood. The most core principle is that insurance is not free. There's reasons why insurance costs money, and it all ties back to the costs of care being provided.
Have we really done anything through healthcare reform to decrease the overall cost of healthcare? We've pushed cost from one party to another. That may help more people be insured, but we have really done nothing to decrease the overall cost and efficiency of healthcare.
We call it healthcare reform. We had health insurance reform. Healthcare reform is still outstanding. That's reform of the delivery system, which is actually driving a lot of our costs.
Well, the best way to get healthcare costs under control is to start by understanding the drivers of cost. And I don't know that the public or policymakers really understand the true drivers of cost. Administrative costs make 10 to 15% of the health insurance dollar on average, and it's the cost of health care where the real driver of health insurance costs are.
The public discussion is for the first time involving the accountability of providers for treatment, and I'm hopeful that that will lead to some real innovative changes.
I think the biggest area of innovation will be in provider payments. The system has been pretty much the same for a long time, and it's been, fee for service. The more you produce, the more activity you have, the more you get paid.
So if we transform the physician payment from a fee-for-service basis to an episode or a budget basis, the incentive for the physician will not be to do more services, but those services which provide value, reduce costs, while still achieving quality outcomes.
Accountable care organizations have been kind of launched by the healthcare reform, and the concept is to make kind of all parties more aligned in terms of their incentives for providing care.
These integrated delivery systems really need to come to the forefront to really help us achieve success. I believe there's a lot of value in getting the providers all together and getting a common platform for managing the costs, managing the care, improving the quality, improving the outcomes. It's been talked about a lot in the past, but now is really the time where it really has to come together.
When we're talking about ACOs, I'm talking about ACOs as a general concept, which is new terminology for holding providers accountable on a population basis as opposed to a fee-for-service basis. If you think about it, insurance companies deal in populations. Currently in the fee-for-service world, providers deal with patients. As soon as you're in a risk environment or an accountable care environment, you're dealing with populations as opposed to patients.
One of the kind of precepts of this is moving more of the disease and case management to the providers from the insurance companies. So under healthcare reform, there's a real strong push to move to these accountable care organizations, patient-centered medical homes, and really make providers be able to see all the data about the patient and use that to manage their care better.
That will be the next chapter of how do we actually take healthcare reform and parlay that into actual efficiency and quality improvements.